How does trauma impact grief? Trauma can significantly change how we experience grief. When someone faces a loss that is sudden, violent, or unexpected, it can complicate and intensify their grieving process. This is often due to the emotional weight of both the trauma and the loss. The typical grieving process can become disrupted, leading to more severe mental health challenges. One major impact of trauma on grief is the development of complicated grief, also known as prolonged grief disorder. This condition can cause intense grief that interferes with daily life. Individuals may struggle to accept the death, feel ongoing emotional pain, and find it difficult to move forward. Research indicates that traumatic losses increase the risk of complicated grief because they hinder the ability to find meaning in the loss and achieve a sense of peace with the deceased. Additionally, symptoms of post-traumatic stress disorder, or PTSD, often co-occur with traumatic grief. Studies show that those who exhibit PTSD symptoms after a traumatic loss are more likely to develop complicated grief later on. Symptoms like intrusive memories, avoidance, hyperarousal, and negative mood can disrupt the natural grieving process. It is important to note that PTSD symptoms may appear before complicated grief, suggesting that early treatment for PTSD could help prevent lasting grief reactions. Trauma can also suppress or delay the grieving process. Sometimes, individuals are so overwhelmed by the trauma itself that they do not fully process their grief right away. This delay can cause grief to resurface later in more intense forms, making recovery more challenging. There is a significant overlap between the symptoms of trauma and grief. For instance, intrusive thoughts, emotional numbness, and avoidance behaviors are common in both PTSD and complicated grief. This overlap can complicate diagnosis and treatment, highlighting the need for approaches that address both trauma and grief simultaneously. Certain factors can increase the risk of complicated grief after trauma. These include being female, having a close relationship with the deceased, avoidant attachment styles, and having comorbid depression or PTSD. Effective treatment often involves cognitive behavioral therapies that focus on trauma-related avoidance and help individuals process their loss emotionally. For those involved in PTSD support communities, understanding that grief following trauma can be complex is essential. This awareness can help survivors and their support networks provide the empathy and patience needed during such a difficult time. Early identification and treatment of PTSD symptoms in those who have experienced trauma can reduce the risk of complicated grief. Support groups and therapy that focus on trauma-informed grief counseling can be beneficial. They help survivors process both the traumatic event and their loss, fostering healing. Encouraging meaning-making and maintaining connections with the deceased can also be therapeutic strategies to ease complicated grief. In summary, trauma deeply impacts grief by complicating emotional processing, increasing the risk of prolonged grief, and often co-occurring with PTSD symptoms. Addressing trauma symptoms early and providing trauma-informed grief support are crucial for helping survivors navigate their loss and promote recovery.